Today, we will talk about how to deal with a bipolar family member. Let's have a look at the details. Having a family member with bipolar disorder can be a challenge and takes patience and compassion. In coping with a family member's bipolar disorder, it is important to support your family member, take care of yourself physically and emotionally, and educate yourself about bipolar disorder. The first step is supporting your family member. Understand that some of your family member's behaviors are linked to the disorder. For example, a person who is chattering about themselves selfishly or bragging is normally recognized as arrogant or self-centered. Recognizing that this is a symptom of the illness, and not an intentional behavior by your family member, is helpful in understanding their condition. Support your family member in their mental health treatment. Since bipolar disorder is best treated with medication and therapy, it is crucial to be supportive of your family member engaging in treatment. Help monitor medication compliance. If you notice that your family member has gone off their medication, the first step would be to notify their psychiatrist or general practitioner as soon as possible. Adhere to a medication regime. Assist during a manic or hypomanic episode. If you notice signs that your family member may be experiencing an episode, it is crucial to engage them in harm reduction. Plan for a crisis. It is important to have an action plan for dealing with an emergency to effectively de-escalate a crisis. Have contact info of important relatives who can help, as well as doctors' numbers and hospital addresses. Help your family member avoid triggers. A trigger is a behavior or situation that may increase the likelihood of a negative outcome, in this case, a manic, hypomanic, or depressive episode. Possible triggers include substances such as caffeine, alcohol, and other drugs. Exercise compassion. The more educated you become about bipolar disorder, the more understanding and accepting you can be. Your concern and thoughtfulness can go a long way in supporting your family member. The second step is taking care of yourself. Practice empathy. Focus on your own mental health. Caring for a loved one with bipolar disorder can sometimes lead to stress and depressive symptoms. Remember that you can only begin to help someone else if you first maintain your own physical and mental health. Consider professional help. If you find that you are having a difficult time coping with your family member's symptoms of bipolar disorder, it may be beneficial to receive your own therapy. And the third step is understanding bipolar disorder. Recognize that bipolar disorder is a biologically based condition. This means it has a strong genetic component and tends to run in families. Therefore, it is not the fault of your family member any more than it would be if they had a medical condition. Understand the different symptoms of bipolar disorder. There are two main types of bipolar disorder: bipolar I disorder, and bipolar II disorder. It is important to identify which type your family member has to understand their particular symptoms and behaviors. Understand how bipolar disorder is treated. Bipolar disorders are typically treated with a combination of medication and therapy. Psychiatrists or general practitioners often prescribe mood stabilizers such as lithium to reduce the symptoms of bipolar disorder. Psychologists, marriage and family therapists, MFTs, and other clinicians typically assist individuals with bipolar disorder in managing and coping with their symptoms. Gain education on the typical effects of bipolar disorder on the family. Family members of individuals with bipolar disorder may experience burden and lack of energy. Additionally, spouses of individuals with bipolar disorder may experience a lack of support, and many do not seek help. Thanks for watching this video. Please don't forget to like and subscribe to our channel if you like our videos.